Finding the right health insurance plan can feel overwhelming. It can be especially hard to know how to choose between two or more health insurance options. There are three key things to consider when picking a health insurance plan. What will the plan actually cost me? Are my doctors and other healthcare providers included in the plan's network? And does the plan cover my prescription drugs? The following tips can be useful when picking a plan. Whether you are buying a plan sold in the state health insurance marketplace, if you are choosing between two or more plans offered by your employer, if you want to compare an employer plan with a marketplace plan, or if you want to compare your Medicare options. When comparing plans, it can be tempting to choose the one with the lowest monthly premium. But to figure out how much the plans may actually cost you by the end of the year, you have to do some math. First, you take the monthly premium and multiply it by 12, which is how much the premiums will cost you for the whole year. Then you add the annual premium to the out-of-pocket maximum. Generally, this is the most that you will have to pay out of pocket for your medical care during the year. If you have a serious medical condition and see a doctor more often, then you are likely to reach your out-of-pocket maximum. Let's say you have two plans offered by your employer and you are trying to decide which one to choose. The first step is to do the math. Plan A is an HMO with a monthly premium of $25, an annual deductible of $2,500, a 70/30 co-insurance, and an out-of-pocket maximum of $7,000. Plan B is a PPO with a monthly premium of $100, an annual deductible of $1,500, an 80/20 co-insurance, and an out-of-pocket maximum of $4,000. On first glance, it may seem that Plan A is less expensive because of its low monthly premium. But you have to do the math. For Plan A, you multiply the $25 monthly premium times 12 months, and you get $300, which you add to the out-of-pocket maximum of $7,000. So the total annual cost of the plan is $7,300. For Plan B, you multiply the $100 monthly premium times 12 months, and you get $1,200, which you would add to the out-of-pocket maximum of $4,000. So the total annual cost of the plan is $5,200. After doing the math, you can see that Plan B is actually the more affordable plan if your medical expenses reach the out-of-pocket maximum. But there are some other things to consider when looking at the cost of the plan. Some plans may have a high deductible, which means that you have to pay a lot of money up front before your plan starts to pay their share of the costs. For example, some plans have deductibles as high as $7,350. Other plans may have a more expensive monthly premium, but have a very low deductible and a lower out-of-pocket maximum, which spreads the amount you have to pay out of pocket throughout the year. After you have looked at the cost of a plan, then you need to see if your doctors and other healthcare providers are in the plan's network. Many plans will not cover medical care that you receive from an out-of-network provider. Even if they do cover some of your medical costs, you will have to pay more out of pocket. After doing the math on the cost of the plan and making sure your providers are in the plan's network, the final step is to make sure the plan covers any prescription drugs you are taking. Otherwise, you may end up paying more out of pocket to access your medications. We hope that this has helped you better understand how to pick a health insurance plan. For more information about health insurance and other cancer survivorship topics, visit TriageCancer.org.